Okay, so I am here to do my last video. I'm going to walk into my patient's room. I would introduce myself to my patient. Hi, my name's Amanda. I'll be your nurse today.
I'm Katie.
Okay, and I would establish a therapeutic relationship with my patient, just so that she feels comfortable with me. I also would want to make sure she's in the proper position for my assessment, so I'm going to start off assessing her head. So she's sitting, that's great. So I'm going to assess her scalp, her hair, and her head, and basically I'm just feeling around on her scalp, and I'm feeling for any masses, lumps, any tenderness when I'm pushing.
No.
No. Kind of pull her hair apart and look at the scalp itself, make sure I'm not noting any suspicious looking lesions or beauty marks or anything like that. I'm making sure there's no lice in her hair, which there's none, so we're good. She's got a good assessment with the scalp. Next, I would assess her symmetry of her expressions, or cranial nerve number 7. So I'm going to ask you to smile for me. Raise your eyebrows. Puff your cheeks. Good. So she passes my test. Her 7th cranial nerve is intact. Next, I would assess her temporal arteries. So there's one on each side. And basically, I'm just feeling to make sure that the pulses are strong and equal. I don't want to be pushing on them at the same, really hard at the same time. So those are good. I'm going to assess her temporal mandibular joint, or the TMJ joint, which is located right here. You can kind of feel the depression by the ear. I'm going to have you open your mouth for me and close, and basically open and close. I'm feeling to make sure that the jaw is moving nice and even. There's no crepitus. Any pain while you were doing that?
No.
So that's what you're basically looking for. I would assess her sinuses, her frontal and maxillary. Her frontal sinuses are right here above the eyebrow. So I would push on those. Any pain?
No.
No. Maxillary is right under the cheekbone. Any pain?
No.
No. If she did have pain with the palpation, then I would do the transillumination test, which I'm not going to do, but basically they say that it would illuminate if there was fluid. So that's a way to check. They don't really know if it's very accurate, though. Next, I would assess her buccal mucosa. I'm going to move to the mouth area. So I'm going to get my little handy-dandy flashlight here. So I'm going to just have you open up your mouth for me, and I'm just going to shine my flashlight in and look at the sides of her mouth and make sure that I don't see any lesions or any white patches or leukoplakia, which I do not. I want to check her teeth, so just kind of show me those teeth, and I'm just making sure that there's no cracking, that the alignment is good. I want you to bite down. And usually in normal teeth, there's a tiny little overbite, the occlusion, so I'm looking, and hers is okay. No big gaps. Her chewing, is your chewing good? Her chewing is, making sure her chewing's well. Next, I'm going to check her gums, so I'm going to kind of have you show me those babies. And I'm just looking for pink, smooth gums, again, making sure there's no lesions, or canker sores, or any sores, or anything that's bothering her. I'm going to have you hold your tongue out for me. If I had a gloved hand, I could take her tongue and kind of move it, but just kind of show me the sides of your tongue. And again, looking for lesions or white patches or anything abnormal. Hers is fine. Next, I'm going to kind of have you tilt your head back, and I'm going to look at the roof of your mouth. And I'm looking at her palate. And as we get closer to the back of the throat, it's more smooth, not as ridged, and there's no lesions or masses on her palate. Next, I'm going to check her uvula, which is the little hangy ball. So I'm going to open your mouth, stick your tongue out a little bit, and basically I'm looking to make sure that it's hanging midline, it's not deviated off to the side, it doesn't have any masses on it, that it's not obstructing her airway. Some people do have abnormally large uvulas, but hers looks fine. No obstruction. If my patient has tonsils, which she does, I'm going to now go ahead and assess those. So stick out your tongue, say ah,
Ah.
just did the eye test, and I made sure that her uvula raised midline when she said ah, and it did. But let me take a peek at those tonsils again. And I'm not noting any white patches. Does your throat hurt you at all?
No.
No? Her tonsils appear normal. I would grade them as a 1+, which is a normal appearing tonsil. I'm going to have you stick your tongue out at me in its midline. There's no drifting off to the side, so that's also assessing a nerve function. Next, I'm going to move on to assess her neck. So just kind of look straight at me. What I'm looking for here is I'm looking that she's holding her head strong and erect. I'm looking to make sure that these accessory muscles look symmetrical, which they do. I'm feeling them. They're nice and strong. I don't know any lumps that jump out at me in her neck. But next I'm going to move to the palpation. I'm going to palpate her 10 cervical lymph nodes. You want to start here in the front of the ear, and then kind of behind the ear, and below the ear, by the jaw, and then kind of just make your way down the neck, palpating the 10 cervical lymph nodes. I didn't note any abnormalities or any lymphadenopathy or enlargement of the lymph nodes. Did any of that feel tender when I was pressing?
No.
No? So that indicates to me that she might, is negative for an infection at this moment. Next, I'm going to move on to the carotids. So you never want to assess the carotids at the same time because it can cause syncope or a fainting spell. But there's 3 areas that you want to feel. You want to feel by the jaw, the midline, and then the clavicle area. So I'm going to feel the left side first, making sure that I feel a nice strong pulsation. Same thing on the other side. And so they felt pretty equal. Next I want to listen for a bruit, which is a swooshing sound, which would indicate a little blockage in her carotid artery. And it's best to use the bell of the stethoscope when you do this. So I'm going to assess all 3 areas. I'm going to have you hold your breath for me. Go ahead and breathe. Okay. Another hold your breath. Okay, you can breathe. I hear no bruit, so that's good. So that indicates to me that she doesn't have any cardiovascular issue with that. Next, I'm assessing her trachea, so I just want to make sure that it's midline, that there's no deviation, which you could see in an injury, or, an obstruction of some sort. So I'm just kind of palpating it. I'm going to have you swallow. And it was all midline, no deviation to the side. Next I'm going to check the range of motion. I want you to lift your shoulders and just kind of move them. Everything's moving symmetrically. Any pain with that?
No.
No? And just raise your shoulders up against my hands. And this equals strength. Next we're going to move on to the heart. So I'm going to assess, just kind of look over her chest. If she had a robe on, I would, kind of have her pull it down a little bit. So I'm looking just to make sure I don't see any masses or lesions. I want to make sure her skin is equal. It's pink, no cyanosis, no areas of bruising, which none of that is noted here. I want to assess her apical pulse, which is found by the 5th rib here to the left midclavicular line. So I'm feeling for her apical pulse, and I can feel it. If I was having a hard time feeling the apical, what I could have somebody do is lay on their left side. If you could lay on your left side for me. And that just kind of brings the pressure over to the left side so you could feel the apex a little bit more. And I don't feel any thrill. You could sit back up. If you would just say 99.
99.
99?
99. 99.
Okay. So everything's nice and even. Next, want to listen to the heart sounds. So I'm going to listen in 4 areas. The right, the left, the apex, the right, the left lower sternal border, and then the 5th intercostal left of the midclavicular line, which would be the apical pulse. So I'm also listening for S1, S2. I will tell you which valve I'm also assessing as well. So I'm going to use my diaphragm here. So 2nd intercostal space, I'm listening to the aortic valve, and that is an S1. Move over to the left 2nd intercostal space, I'm listening to the pulmonic valve, and that's an S2. The left lower